a radiologist will always be a clinician's clinician and a consultant's consultant.
अगर आपको रेडियोलॉजी पाताल में भी मिल रहा है तो वहां पे जाके ले लो.
Please do not become a radiologist. We use preclinical anatomy, we use paraclinical stuff, preclinical stuff, jot them together with the clinical stuff and give a report. So radiologist is a central branch. Hence, freshers clear it way easily if they study, then repeaters. Ban gaya radiologist.
Hello everyone. If you ask any of the PG interns proper, out of 10, I'm sure 7 will tell you that I want to take radiology. What's so special about it? Why it is a dream branch of so many people? Why it is preferred, and what are the pros, cons of this field? What is the routine, and how is the life after completing the post-graduation? So in this video, we will be talking about all these things. Those who don't know me, I am Dr. Qaziarifuddin and I am a general surgeon. And in this video, I have invited a very special guest, Dr. Preetesh Bhandari. Dr. Preetesh is one of the young dynamic radiologists who has completed his MBBS from KG Somaiya Medical College, Mumbai. And after that, he has done MD in radiodiagnosis from Government Medical College, Aurangabad. He had a glorious academic career with lots of prizes and certificates after his name, quizzes, anchoring, dancing, speeches, and the list continues. Now he has completed his post-graduation and presently he is working as a senior resident in Chhatrapati Shivaji Maharaj Hospital, Thane. I am very excited. So let's start the video. Hello, Dr. Preetesh, and welcome to this video. And it will be a fun to talk to a radiologist.
Yeah. Thank you so much for the introduction, and thank you for giving me an opportunity to help my fellow colleagues about how to go regarding the field. I'll put a disclaimer first, जैसे कि whatever I'll be saying right now is what I think about the field as per my experience and what I've seen outside now and what I've learned from my seniors. तो हो सकता है कोई believe करे या कोई agree करे ना करे, but wholesome idea I'll try to put forth.
Okay, sure. So this is how it works, because everybody have their own experience. Yeah, exactly. Because some of the people जो ऐसे भी हो सकते हैं कि they got radiology but they are not happy, और ऐसे भी होता है कि they got some branch which is not very desirable for them. So in later on they can enjoy it. So it's totally subjective thing. So Preetesh, let me take back you to the that preparation days after very hard working days and very tough days. I would say that is the toughest part of everyone's life, especially in our medical field. So when you got that rank, I guess it was around 1,000 or like that. You had lots of opportunity to get different colleges, different institutes, and also you had a chance to take skin medicine, orthopedic, or other branches. So what was your feeling at that time?
So we prepare and we keep judging ourselves कि भाई हमारा caliber कितना है. So when I was in my preparation phase, the entire what I say, my college was very much assured कि भाई तुझे नहीं मिलेगा तो किसको मिलेगा. But it was as I gave my mock exams and stuff, so I was settling for somewhere 4,000 to 5,000 rank. मतलब that was like a reality check for me कि भाई इतना आएगा, and as per that जो branch मिलेगा, and I knew कि मुझे क्या नहीं चाहिए. I never wanted medicine, I never wanted OBGY, but I never had a specific liking to one particular subject. So I was very much flexible कि भाई rank के हिसाब से जो मिलेगा I'll take, but I will not repeat. So I was very much against repeating. So luckily, surprisingly or hopefully, whatever we say, I got a good rank and then ban gaya radiologist.
Yeah, that's so humble of you. You are saying you were expecting somewhere around 4,000 and 5,000, but when you got that rank, we can understand how much efforts you have put in to get that thing. You have a very good, glorious academic career, especially during your UG days. You have lots of certificates and you have participated in many extracurricular or curricular activities also, like quizzes, then anchoring and all that. So tell us about your journey, especially your journey in undergraduation.
Okay. So my MBBS was from Tejas Somaya Medical College, Mumbai. We were a batch of only 50. So when you have got such a less people in your batch, whenever there are events, whenever there is anything, organize भी 50 ने करना है, participate भी 50 ने करना है. So it's not just me. Many of my friends have done many things, many wonderful things. We were good. We were, I won't say good, but we managed our studies, and side by side we did perform, we did quizzes, we did extracurricular activities, everything. Because there is a very important thing in MBBS is balancing yourself. So if you are doing good, if you are studying since any initial time, it's okay. It's very important for you to relax.
Guys who are undergraduate students, you can see that you can balance both of the thing. Don't no need to stress yourself for the studies only, because undergraduation is the time where you have to enjoy your life as well as you have to study, because that is a golden period that never comes back.
So one thing I want to say here is you need not study less. You need to be consistent instead of rushing at the last moment. I'm talking about this specifically for entrance point of view. So I started my entrance journey from first MBBS. I finished the third year subjects in third year from the MCQ point of view. Final year subjects in final year, and all my first and second year subjects when I was interning. So the peak time when you can crack an entrance is only during the internship when you are a fresher. Once you decide to wait, repeat an entire year and think of doing everything, then it's a bit difficult. Why? Point one, because when you are fresher, you keep concise material to read. You know that you won't be able to read everything. So that is what makes you to read in a smart manner, concise manner, and revise that things again and again. Once you are post intern, you feel that you have an entire year to study, and you go on digging up different notes, and you want to fill more and more information in yourself, which you cannot revise at the end. That confuses you more during the exams. Hence, freshers clear it way easily if they study than repeaters. So give your 100% when you are giving your first attempt.
You have cracked this post-graduation entrance in the first attempt only.
Yes, with completing my internship without bunking a single posting.
Oh, that's great. That's like dream of each and every student to get MD radiology seat in your first attempt. That's a big achievement.
I completed my pediatrics posting after I got my rank and after I submitted my documents for my admission. Still, I completed my posting.
That's great. That's great. Okay. There is one very important question comes to my mind, that during our UG days, we are not much exposed to the radiology. Usually MBBS students, if they are interested in radiology or not, because from my side I can say, as a surgeon, students, they come to wards, they come to casualty, OT, they see us performing surgeries. So they can relate, some of the students, they can relate, they can dream of getting that thing, but this thing does not happen with radiology. So how to judge if we are interested in radiology or not?
So I'll just start with saying that भाई कोई भी branch लो, whatever branch you choose, it's always going to be a leap of faith. You might begin with liking a branch and you might end up disliking it. Unless you are in someone's shoes yourself, you will not know what it is. Right? Even if you go and see the surgery, you're just seeing it, you're not performing it. Okay. So as far as the exposure to radiology is concerned, I would divide it into two parts. One is the reporting and one is the technical aspects. So I believe reporting aspects, we are well versed even in our UG days. हमको सब कुछ सिखाया जाता है. We know what a radiologist reports. If we are in medicine, we know effusion कैसे दिखता है, and we cannot pass our table viva without knowing that. Surgery में we are taught about all the emergencies, emergency X-rays, न्यूमोथोरैक्स है या वॉल्वुलस है या ऑब्स्ट्रक्शन है, कैसे दिखता है, you are supposed to know for passing MBBS. The same thing in pediatrics, same thing in OBGY, USG findings and basic CT, MRI science. Plus, when you read for your entrance exams, you know much more of radiology. So coming to reporting point of view, you are introduced to it very well. We don't know about the technical aspects of radiology. Okay? What happens behind the scene, basically. So that is one thing that we don't know, but it doesn't form. It is like every other branch. जो दिख रहा है वो है, but पीछे क्या है वो we don't know. So radiology कुछ अलग, it doesn't set radiology apart, and we cannot say that radio में exposure कम है. We know very well, we learn about it everywhere, but we just don't know the technical part of radiology, for which we will understand in our residency. What is dark room? How does a USG function? What are the prerequisites for taking a good CT scan or MRI scan? ये सारी चीजें हम रेसिडेंसी में सीखते हैं. Rest all is taught to us.
Okay. My next question is, when you have got the rank, you have so many choices, and it is very difficult to decide about the institute, because there are a spectrum of institutes. Like some of them are tertiary center where you can get all the available facilities, or at the same time you can get a peripheral institute where there are very limited infrastructure, and in that, but you can get a very good patient load, and I would say exposure. How to choose any institute?
So what I believe is, you go on making your way. If you want to reach a specific ocean, you go through the rivers. तो अपना रास्ता बनाते जाएंगे तो पहुंच ही जाएंगे. So I believe कि learning goes on. Lifetime we get to learn, we go on learning. So if you are particularly interested in a branch, in a field, you, instead of if you have to select between a college and a branch, give first preference to the branch, because that is going to stay with you for your lifetime, and within the branch whatever learning is there you can do it even after you get your degree. And as far as radiology is concerned, how to select a college, first you have to see whether there are all basic modalities in that particular institute. By basic modalities, the four modalities I'm talking about: CT, USG, X-ray, MRI. If you get all the four modalities, then you come to the patient load, patient exposure, and how is the working pattern, etc. But the main concern is the modalities, and even if you don't get all the modalities and you are very keen of taking radiology and there's only basic USG and X-ray, I think you can still go ahead, and you have better opportunities in the form of fellowships to learn other modality in future.
During my preparation days, senior used to tell me that अगर आपको रेडियोलॉजी पाताल में भी मिल रहा है तो वहां पे जाके ले लो.
Depends how much you have the liking for the subject, but yes, it is somewhere true. Even I would do that. मतलब कहीं पे भी my all the periphery options were always above the other clinical branches which I filled. That means I was ready to go anywhere for radiology. So yeah, that's true.
So coming to your PG days, what to expect during the residency, and what was your routine during your residency? Because as a surgeon, we are always jealous of radiologists, because you will be most of the time sitting in the AC room and on the chair, and just whereas we as a surgeon, we are always in the casualty doing something, or in the OTs standing most of the time. So what was your experience? What was your working pattern? Tell us more about that.
See, first of all, I'll say the grass is always greener on the other side. Okay, so ऐसा नहीं है कि radio residency I'm talking about. Residency first year and second year is equally hectic. The only thing is there's good work division in radiology. So when a group is having emergency, the other group has an off. I mean, we get a good sleep. I mean to say. Secondly, you spoke about radiologists always chilling. फर्स्ट ईयर में तुमको कोई भी गवर्नमेंट इंस्टीट्यूट में तुम जा रहे हो, फर्स्ट ईयर रेडियोलॉजी में तुमको चिल करने नहीं मिलेगा. फर्स्ट थिंग इज दैट. एंड Yeah, post residency, it's quite good. It's stress free, structured life pattern is there. But in residency, your working pattern is completely dependent on how other clinical branches in your institute are working. तो जब सर्जरी, ओबीजीवाई, मेडिसिन वाले नहीं सो रहे हैं तो आपको भी भाई नहीं सोने देंगे. Okay, so it's just that our work is more of mental work rather than physical work. Day one, I went to my department with an expectation of 9 to 5 hoga, chutti ho jayegi, I'll be free, I'll do this in the evening and stuff. But trust me, it was 2 a.m. when I left my department on day one, and I understood what a residency in radiology is. So never join radiology just because your residency will be less hectic, क्योंकि वो नहीं होगा. You have to work, plus you have to show efficiency right from the start. Day one पे if you are sitting on a console in front of an X-ray, day one radiology resident से day one surgery का resident पूछेगा कि तुझे क्या लग रहा है. It's day one for both of you, but you are already a radiologist for them. So people start judging your capability right from day one in residency. Unlike residents in other department, okay, their mistakes are confined within their department, but being a radio resident, your mistakes will be shown everywhere, and you will be judged. Even if you are a student, you will be judged that this person's reporting is weak, this person's reporting is strong, and throughout your learning phase, it will be like that. So this is one main thing which I came across residency. Even though you are learning, you will be never expected to make mistakes by others. Let it be your seniors, let it be your colleagues from other department, let it be the faculty from other department. So once you are into radiology, they think you are a radiologist, and that competition with your own self, or that uh, raising the bar, learning without making mistakes, that makes radiology residency difficult. It's all mental game. Even though people think physically सब कुछ बहुत अच्छा है, but mentally what a radiology resident goes through while learning is something else that no other department's residents go through.
Important thing you have told that your performance is judged by other doctors, whereas our
Yeah,
suppose I have done some surgeries and there are some complication or like that. It's the patient, and being a non-medical, he will be less able to understand that thing. But when you are reporting something, even if you have done a rigorous residency or you have learned from a very top institute, but when you give us any report and I see, and I'll be the judge in front of the patients, and I'll be saying कि नहीं वो उन डॉक्टर साहब की रिपोर्टिंग इतनी अच्छी नहीं है. So that's a kind of very I would say very difficult job for you people, because I remember
right. It is more
when
difficult when you are learning. It's more difficult when you are learning. Even if you have not crossed the finishing line and you are judged at every point. If you एक ही महीना बिताया है, you are supposed to know X-ray better than your surgery colleague. That is what my point is. So you will have to face that. My point of raising that thing here is, अगर आप रेडियोलॉजी रेसिडेंट बन रहे हो तो आपको ये सब फेस करना होगा, दिमाग में रखना होगा कि the world will judge you, but you have to go ahead accordingly and learn from your mistakes. The key word is learn from your mistakes. You cannot avoid mistakes, but learn from your mistakes.
for my viewers, I would like to say that Preetesh and I was working in same medical college, and I remember during his residency time, because of my interest, I used to go to USG room and CT scans, and where I used to gain more information about the patient. So he is one of the resident who used to take the feedback. Like if he has given a report of acute appendicitis, then he will call you after the surgery, and he will call you what where my findings were matching with the intraoperative findings or not, and what was like how can I improve myself. And that is one of the very best thing about him. So that is also a lesson for other aspirants, that if you should have that passion towards the field, that every day you have to be better than what you were yesterday. So that is a very good thing I have seen in Preetesh. Maybe that is the reason I am very much impressed by him, and he is here in front of you. So
Thank you so much. That's very kind of you.
See, we everybody during our PG preparation time, we all tell everything good about radiology, that very structured life, and it's also high earning branch and less hectic as compared to other branches. And mental peace is one of the very important thing. There is no much responsibility as compared to your other colleagues. There are so many plus points in radiology, but tell me, what are the negatives of your branch?
Terms of my branch, the very first thing about negativity is the appreciation. If you are looking forward to get appreciation from your patients, if you are looking forward to connect to your patients, if you're looking forward to get good words from your patients, please do not become a radiologist, because patient has nothing to do with you. If you have diagnosed something for the patient which has helped the surgeon to cure the patient, patient will remember the surgeon. Patient is not going to remember, not going to ask कि किसने बताया तुमको मुझे प्रॉब्लम है. So appreciation from the patient, no. From the clinician, sometimes you can get, sometimes you cannot. Second thing, positive feedbacks, you will get 2% of time. This was the thing which you reported and this was exactly what was found. Negative feedbacks, if any, you will get 100% of the time. That is good for you to learn, but what I'm trying to impart here is acha kaam, good work is not appreciated that way as appreciated in other branches. Third thing is your skills, the proportionality between your skills and your earnings. It's not like that a good radiologist will earn more. Your skills are not proportional to your earning in radiology. Your finance or your marketing skills are in fact helps you more. If you can if you can put your own center, if you can start working, no matter how good or bad you are, you will earn definitely more than a very skillful radiologist who is working on daily basis with freelancing. So these are some drawbacks of radiology. But you said it's a money branch. It is, I would say, there is decent pay, decent money, but radiology is a gold mine, is just a myth. Uh, yes, not less, but a decent pay. So these are the drawbacks. Main drawback is, like I said, the first, appreciation from patient is not there. You can never be as famous like your fellow clinician.
तो इन नटशेल ऐसा है कि आपका काम एक फुटबॉल गोलकीपर जैसा है. अगर आप गोल सेव
Exactly.
करते हो तो आपको कोई अप्रिशिएट नहीं करता है, बट जब भी गोल जाएगा तो गोलकीपर को जरूर बोला जाएगा कि आपकी वजह से यहाँ पे गोल गया है. Okay.
Exactly.
So coming to the next question, it's a kind of a bit controversial, or like because most of my viewers are PG aspirants, so
Mhm.
to inform them or to better understanding for them, uh, what to choose, how you will compare a government institute from a private institute.
I would not say कि private, a candidate passing out from a private and from a government institute, if I'm comparing, knowledge wise, both good, and both are almost equal. Academic knowledge दोनों का एकदम same रहेगा. फर्क कहाँ गिरता है is in the confidence with which you approach a patient, because the exposure you get in government is hilarious as compared to the private. So बात आ जाती है exposure पे. Academics is good both. Your efforts are good at both places. बस exposure थोड़ा government में ज़्यादा है rather than private, and उस हिसाब से आपका confidence और approach to deal a patient is different as compared to private. MLC cases को कैसे approach करते हैं वो आपको government में सीखने मिलेगा, आपको private में नहीं सीखने मिलेगा. And one more difference is medical life को हटा के भी non-medical life, the other aspects of life which you learn in a government hospital is very different than what you learn in a private hospital. So government hospital के doctors ने सारे जुगाड़ किए हुए थे. So that is the thing. That is the main difference, and that's it.
Because in government institutes you get to see very complicated cases, neglected cases, some of the very some diseases which are very prevalent in lower socioeconomic class that won't approach to private institutes. So that is also one of the factor, I would say. But for private institutes, they might have better quality of equipments or infrastructure, because in government some of the times it's like 1.5 Tesla MRI in government institute, whereas you can get 3 Tesla MRIs in uh, private institutes. So that is
some
also one of the
report,
factor.
some
But
report.
does that impact for your future life?
See, like you said, the MRI 1.5 Tesla or 3 MRI, that really doesn't equipments तब equipments तब काम में आते हैं जब आपको उनको यूज करने आ जाए अच्छे से. फर्स्ट थिंग, जब पेशेंट एक्सपोजर ज्यादा नहीं है तो इक्विपमेंट्स कितने भी अच्छे हो, आप उनका इस्तेमाल करना सीख नहीं सकते. सेकेंड थिंग, लाइक आई सेड कि गवर्नमेंट में nowadays government facilities are extremely good. Like I have done from a government setup, and I can assure you that our radiology department was no less than a private setup. We had tomosynthesis in mammography, which is hardly found even in private setup. We had 128 test, 128 CT, which is as good as a private setup. We had 3 Tesla MRI, which is as good as a private setup. So, talking about my institute and the other government radiology institutes, since we scan so many patients, since the patient load is so much, in radiology, I don't think so there is much difference in the equipments, like you said. There will be a lot of difference in the cases that you see. Definitely, there will be a lot of difference in the cases that you see, because a poor patient cannot afford CT and MRI, even though it is there in a private setup. The patient cannot afford, and the private hospitals have to refer the patient to government hospitals so that the patient can undergo CT and MRI. So that is the perks of being in government setup, that you can have all the investigations done for the patient under one roof.
So there are so many doubts about radiology, that there are no patient connection and it is very dependent branch. Some say that it is a paraclinical branch, whereas others say it is very much a clinical branch. So what you have to say about that?
First, I would take the first part of the question, like you said, ki, many think that there is no patient connection. So the statement per se, there is no patient connection. If this comes from the patient or layman or non-medical fraternity, I would accept it. Okay, a patient will think that there's no connection because patient really has no connection with us. But if the statement comes from a medical fraternity, from a clinician, then it is a false statement, because even they know that we are clinically involved. Uh, I would say that no medical management team or surgical management team is complete without a radiologist. A radiologist intervenes in the patient's management or is the part of management team. Now it depends if the radiologist is actively intervening or a radiologist is passively intervening by his reports, but a radiologist intervenes. So here I would put a light on ki whatever reports we do, एक चीज है कि मैं रिपोर्ट बढ़िया तरीके से लिख के क्लिनिशियन के पास पहुंचा दूं एंड एक्सपेक्ट हिम टू अंडरस्टैंड एवरीथिंग, एंड ही श्योरली विल. एक चीज है कि मैं उस क्लिनिशियन से बात करने की कोशिश करूं रिगार्डिंग द पेशेंट्स हिस्ट्री एंड द फाइंडिंग्स व्हिच आई फाउंड, एंड इस तरीके से बोलूं कि माय रिपोर्ट इज going with the clinical condition of the patient. Now you analyze the patient. So every radiologist, whenever he reports a scan, has in the mind कि मेरी रिपोर्ट पेशेंट के क्लिनिकल कंडीशन के साथ जा रही है या नहीं. So we might not be connected to the patient per se, one to one interaction नहीं होगा, but we know about, we know or we need to know everything about the patient. जो हिस्ट्री आप लेते हो वो हिस्ट्री हमको भी लगती है बिफोर वी रिपोर्ट, बिकॉज देयर आर सो मेनी डायग्नोसिस which will be looking similar, but which differential would come first, that goes on the history. If I get a very good history, I'll report better. If I get no history, I will put down 6 to 7 differentials. आपने मुझे पेशेंट की क्लिनिकल कंडीशन अच्छे से समझाई है या मैंने खुद पेशेंट से अच्छे से पूछा है, तो आई वुड गिव 1 or 2 डायग्नोसिस ओनली. So clinical, we are expected to know right from the clinical condition of the patient to the imaging findings, which is the main part, to what will be the management of the patient. So if the patient has to undergo surgical management, हमको उस तरीके की report देनी है, so that a surgeon knows where to incise and how to approach. तो अगर patient बोल रहा है कि नहीं, we are not interacting with the radiologist, very true, but if a clinician is saying that it is false, so there is very much interaction, clinical, paraclinical, preclinical. रही बात preclinical, paraclinical, clinical की, we use preclinical anatomy, we use paraclinical stuff, preclinical stuff, jot them together with the clinical stuff and give a report. So radiologist is central branch, हमको हर चीज का knowledge चाहिए and हमको हर चीज की, हर चीज का यूज करके, we cannot be a good clinician or we cannot be a good radiologist if we do not know anatomy. Applies to the surgeons as well. So हमको preclinical की जरूरत है to be a good clinician. So radiology को आजकल बोला ही जाता है clinical radiology. You also have to put in your brains and apply. Abhi, if there is, if even if I perform a Doppler, I would definitely try to feel the peripheral pulses myself before before giving a report. So every time when we give a report, we will definitely have the clinical scenario in our mind कि क्या देना है. So without clinical knowledge, you cannot be a good radiologist, and radiologist is definitely a very much clinical branch.